Yat Benishik Edoshidine, Kodo Yad, Yet Kujahana, that's a Yokis, Ado Shea Perphelia Fowler in Chia, my days gizning strong toward any bashin. Traba Edashe, Ado Ashe Edashanale, Totus Aholiera, Ade is Chishike. Kohe Kajana, that's your gizi, Kodo Eya to the Zendini, but Anel in Kodoshi to the Zendole. Kodehojon Role, Shamana Hassan Yadeshil, Zitlistan, Twistan, Halch Halch Ewan, Adona Dalke na Dalsui, Tradadin Ani, the Yindine Edanoslini sa Anarabik a Hojon, Kodoidi Binibi, Danahikal, Nihe ol Ilonihe na Oka, Ado Eya kun Nihe Kea has Ango, Yat Eln Hilnahuidot al. Aro aas kon kadota is ai na habel kon lodole bezad lini bin sekes bin hat at lini in trolo na haba insen dole aas kon hidene dan lini kon da is ai ado ho ti istliji dan lini belash la dan lini kon bedo betrahiata hot dole kodo ishin bich ishtan edeni zini yikit it hi dole yikit it ha dole ado nas kon netnije Ye nanat edo bedo be not hindole. Ahala di con de cosnas states adapti nini chostoit ini bedi nini nas doiki nihit adolto adich adit ado con da hastani do omban hilda hojo njono lam he nada hadolt hildo con nihinal tloshi baati nin hita ak baati ne also. Aro kon hil has angon hi konta del on hi honesh gishnas kango ni hit hotnas kango ni tisk enas lago ya hot ekon hil na huido a na has twin his zani dan lini til ket dan lini kon ni kon hasan ka ina gani hon khaba hol ya dole be jebits ke a insen dole a altronich ka olni gon ha insen dole ha ishin kodoyi ka chonan lini hon khabelek adile Yoda bosado es bosado aqui jehonas bonet nije. Ado hashine la kon nihidine etan lini hon bike eta hastin. Jala hot end kon hasa ati bekantne tani kon nihilkon lodo le arts kon bicha ini lo en hinsen. Bich in hits heto bich in hit zilo en hinsen. Ado kon nanish nihilek enas lahi hon nihinanish lini ba huilian dole. Belneil nishi denilzen dole nihinat anin lini denilzen dole ado not anin lini dot dan hitosen ni in hinsen ado ni alchinin hi yajin hi awe da ultra il to hon juno hon nada istra ultra juno ich da nadi kredole juno nada hol a dole juno ultra gen nahas kredole ado bata ultra dan lini ko betka hi nada hot edole bi khata huisto gon juno ho banada ultra dole nasgo ne nije ado ko o yugo nat anle tratnas de dan le besh bahasa anadan le ado ho zel embelnas ango ho ado kon talada belnas ango yat ehon na alte ole alt ko benashni ole ko ni humana hastan kon yadel lini ko anols ko ni hit na khata hol yad ole ni ket adon len hit itaj ho ado consulatso dan lini la benashni dolen halchin yajin yawe yat ehon nada kedole alt konich khata anon kha insen dole ado kon ezel idanas dadi walyatanas dane edo na khabel kon lodole alt kon benashni dole ado kon belah isla bo isla ben hinat ahol ni dole hit so de zendon hi na khana da di dole nas konet ne Quanto eto de lini an shende be hanana sit dole ati de ben hich wajon hasli dole wajon hasli ich ha shik edo shidne achedi kodon hinat an lini Honorable President Nez Tilin Lini Jonathan Nez Kodo Nihich Hanado Mr. President.
All right. Good morning, everybody out there. We are in Payson, Arizona at the Tonto Apache tribal lands here on our way to Phoenix. We will be meeting with the First Lady of the United States, Dr. Jill Biden, of course, also with the second gentleman in Phoenix at a school today. So that's where we're headed, a day trip and down there and then back into Window Rock this evening. To give you an update, last night we were on KTNN Live giving updates, and it was also streamed live on our social media pages. We didn't mention the updates for total COVID positive cases thus far. That is 30,997, and 29,615 have recovered. 1,352 have lost their lives to COVID-19. And yesterday, no deaths, but three cases. If you put that slide up, Eli, slide 1, gives you a rundown of all 8 service unit areas throughout the Navajo Nation. Border town numbers also: Chinle, Crown Point, Fort Defiance, Gallup, Kayenta, Shiprock, Tuba City, and Winslow. Thank you for your prayers. Go to the second slide. The second slide just gives you an overview of what's happening all around us. You know, there's this Delta variant going around, as you all know, and the public health experts have said that the Delta variant are putting people into the hospital, COVID-19, and they're finding out that those that are ending up in the hospital are the ones that are unvaccinated. So if you are vaccinated, it'll push back on the COVID-19, the Delta variant. But if you look at the numbers here, the top red one is Utah, and then the next one underneath Utah is Colorado. The third red one there is Arizona, and the fourth red is New Mexico. And these are the states all across the country. And look at where we're at, Navajo Nation. It's quite lower in the statistics, right under Nebraska. So continue to mask up, continue to follow these protocols that are in place. Those of you that are still on the fence of getting vaccinated, you know, we encourage you to get vaccinated for your Navajo relatives. If you go to the next slide, it shows you the breakdown of all the variants. You got the Alpha variant B117, 58 here on the Navajo Nation. The Beta, there's none. The Gamma, 4. Epsilon, 18. And the Delta variant, 1 in the Shiprock service unit. And these are variants that are prevalent. If you go to the next slide, gives you a breakdown on the COVID-19 vaccine administered to eligible population. United States, 63% at least 1 dose. Here on the Navajo Nation, 69 at least 1 dose. You know, these are numbers based on, again, non-Navajo residents also that are included. So that doesn't factor just the Navajo residents or Navajo people living on the nation. On the United States, 54% fully vaccinated. That means 2 doses, 2 shots, I mean. Navajo Nation, 62 fully vaccinated. And we're also factoring in the 12 to 15-year-olds too. So that is where we're at right now. 85% of what was given in the United States have been put into the arms of our people throughout this country. Here on the Navajo Nation, 98%. So those of you that haven't received a vaccine, I don't know what's going to happen when we run out. You know, we need to, of course, advocate for more doses, but I hate for us to run out and those that want to get vaccinated don't get their their shots, but that's something to keep in mind. The next slide, the yellow slide, shows the yellow status for 10 weeks now. So we've been in yellow 10 weeks thus far, and shows you a breakdown of how the epidemiology team and the HCOC is monitoring this, and again, 10 consecutive weeks. The last thing I wanted to update you all on is the last slide there. You know, we're trying to encourage our Navajo citizens to stay on the Navajo Nation 4th of July weekend. We didn't have a 4th of July celebration last year. And so we want to, you know, have some family time here on Navajo. And to encourage you to stay on Navajo, we are doing a 4th of July fireworks series. These fireworks shows will be done throughout the Navajo Nation starting this Friday, July 2nd. We'll be in Shiprock, New Mexico at 9 p.m. Saturday, July 3rd, we'll be in Tuba City at 9:30 p.m. Window Rock will be Sunday, July 4th, 9 p.m. And Monday, July 5th, Chinle, Arizona, 9 p.m. Remember, this is a 3-day weekend. So Monday is a holiday, but Monday evening we are going to do the fireworks. And it's brought to you by the Navajo Nation Fair and the Navajo Nation. So, you know, we encourage you to stay here, spend your money here on our businesses. As you see, numbers starting to fluctuate all around us again. I think for real, for us here, it is very safe to be here on the Navajo Nation. So that's going to be my update thus far. Again, we're on our way to Phoenix to meet the First Lady and the second gentleman to discuss some of our priorities and also remind them of the needs of our Navajo people. And take care of yourselves. I'm just going to make this all in English today. We were all in Navajo last evening on the radio. If someone doesn't understand English, I ask for you to help me and translate to them, because I like to give some time, a little bit more time, to our healthcare professionals today to explain to you the importance of getting vaccinated and talk a little bit more about the Delta variant that's spreading. The other item that is at our desk is the legislation to reopen the parks, reopen the schools, and reopen the chapter governments too. And the team is assessing that legislation right now, and we are looking at that bill, just to let you know. But at the same time, we got to keep our Navajo people safe. But I think we all know what to do now, right? We've gotten all the information. Now it's upon us as citizens to wear our masks. Masks are still mandated. Business owners out there, you shouldn't be having anybody, even our visitors, come into our stores, places, without a mask. So let's start enforcing that, especially if we reopen our Navajo Nation. So thank you so much, everybody. I'm going to turn the time over to our Vice President, Vice President Myron Lizer. Thank you all.
Oh, yeah. Thank you, Shinata. Appreciate it, Mr. President. Here we are over at Kindlechi chapter, where we're going to dedicate a new backhoe here. So thank you for your leadership, sir. And today, as we're out here in the chapter, we're looking forward to just mingling with our fellow leaders. Delegate Vince James will be here a little bit later. And what a fine, heavy equipment piece this is. Again, backhoe dedication here at Kindlechi chapter. So I appreciate it. So real quick, thank you for joining us on this June 30th town hall update. Yeah, I've stopped calling it COVID-19 town hall update. And I think these are the norm now. to be doing these town hall updates, just to pass out information, updates, and then be transparent for the Ms. Lizer administration. So we appreciate all of you for joining us this morning. Prayers go out to our president on travel as he's heading down to the valley. So prayers for safe travel. Appreciate his leadership as well. And so we just want to thank our health professionals again. And I don't want to, be redundant with anything that they're going to be saying, because obviously they're the ones with the knowledge and experience and the talent to be giving us the updates. So we appreciate our health professionals. So thank you, Dr. Jill. Jim, I believe you'll be following me right after my segment. So again, we're over here at the backhoe dedication at Kindlechi chapter. What a beautiful morning. Praise God. We got rain last night. We still see puddles all over here. And of course in Winterot, we received a lot of rain. And we just give credit to God. Dian God, Shijat Dian God, the blessing of rain. And of course, not wanting to take credit, but there has been prayer by leadership to repent and to ask God for healing on the land, healing for the people, and rain. Just open up the windows of heaven and pour out more rain for our animals and for all of the ranchers out there, and just let the land be blessed and let it return back a bountiful crop in the fall, in harvest time. So again, without further ado, I'm going to read some numbers, which I always do, give you updates here. We have the latest from Arizona. If you remember, we're 16 months into this, 894,106 with 546 new cases of COVID-19. And we have to be careful. We're seeing some rising numbers all around us here. So as you know, there's the new variant that's out there, the Delta variant. So before that, there was other variants, and we're just needing to be still personal responsibility as you go out there, masking up, cleaning your hands, and social distancing. And these are just common sense, right? And so we're all well versed in this here. Deeper down, we have Apache County at 11,483 with 2 new cases. So Apache County, you're doing good. Navajo County, 16,675 with 24 new cases there. So we have to continue to mask up and just be diligent out there. Coconino County, 18,675 with 0 new cases. So good job there, Coconino County. We also have Colorado. As you know, we own land in Colorado, giving updates on the numbers, what that looks like here in this pandemic. 557,347 with 236 new cases in the state of Colorado. So be informed there, Shadina. New Mexico, 205,484 with 52 new cases statewide. So good numbers for the state. San Juan County, 15,720 with 7 new cases to report there in northwest New Mexico. And bringing out the counties there in New Mexico, 12,376 in Gallup-McKinley County with 0 new cases. So good job there, our neighbors there to the east. We also want to bring about, as we migrate over here, to give you a look at the new backhoe here that's going to be given to Kindlechi chapter. Utah, 414,565 with 361 new cases to report there. San Juan County there in southeastern Utah is 1,932 with 6 new additional positive COVID-19 cases. So we've kind of seen a little uptick there in that rural region there in southeast Utah. And lastly, our own Utah Navajo Health System reporting in at 1,104 total cases 16 months into this pandemic with 3 additional cases. So again, a little concerning. There is an uptick there of numbers. For a long time, they had been standing pat with no new cases to report. So and there you have it, the latest updates here in the Navajo Nation. Our numbers have been decreasing, and we've had a 11, 12 day moving average that is really looking very, very good. Very positive. Well, I shouldn't say that in this realm, in this segment, but the numbers have been trending to look good, where there is a new public health order. And I'm going to leave all that information out for our health professionals here. So again, Vice President Lizer here, Comanche Nashlet, Hohana, Bashichin, Otto Comanche Dashiche, Lashi Dashinelli. It is good to be with you here in the very beautiful and wet chapter of Kindlechi chapter. So we appreciate the leadership here. Again, we're going to be dedicating the new backhoe here through the chapter from the CARES Fund. If you remember, all the chapters got some heavy equipment. So here we go with Kindlechi chapter's new backhoe. So right now, I'm going to sign off. I got to take part in this dedication of the new backhoe. I want to thank Mike Sosi, the chapter secretary treasurer, and also Alfred James, Kindlechi chapter president. Oh, vice president here. And some of the guests that'll be here, and Empire Machinery out of Sholo, who I guess gave didn't give, but brought the heavy equipment here to the chapter. And this will be an ongoing event during the summer as all the new heavy equipment comes out to the chapters. So we appreciate everybody's leadership. Thank you, Dr. Pearl Yellowman, for your leadership there, leading the community development division as well. So again, I heard my name, so it sounds like it's time to go and present here. But appreciate it. Again, keep President Jonathan Nez, who's on travel, in your prayers here, and also the people of the great Navajo Nation. Leadership continues to pray for you. So God bless you, and may God bless the Navajo Nation. Dr. Jim?
And we have
Sig édó si duna hé non cadét ní dó ha a Dyson ge sé Dr. Jill Jimmy siadó donna in sinné log art na son tratini bas chin dó sé de sé dó is a fanné nala adó hat stans na dó it's is bahi on the epic bahi on the epic edins in dó di just say all quality the question sagi na states adó heliani ge o is so bad as the a don a quality a KTNN the quality public health order heliani ge a update is do do it's is Jin dot initiate dot quality outdoor recreation events guidelines dot anything do in-person gathering shamaha at Dr. Follow your hadzi to Oshin quality the question sagi non states ado hagenige ani yago desk do I say necha one on the Oshin quality the is it bahalonigation chodani do and chin but jodi quality non kids up and dark hegi do they go a quality coba that tell it that the net the is it in it on this so although the public health order gay quality we are no longer in shelter in place with the a safer at home with the public health order number 12. I don't need yellow status though at the quality for business reopening at 50% though that refers to restaurants that any though lodging, camping, those sorts of activities out there for the Navajo Nation people as well. Also Other areas is churches and places of worship at 50%. Also allowed is the 25 individuals for Bible study school, and they have to follow the in-person training guidance that we have issued out. Although the 25 persons for social gathering, as well as the traditional ceremonies that might include song and dance or powwow, that any of those are under traditional ceremonies. What actually to make sure that you can gather safely at 25 individuals, and some events for other outdoor events at 25 persons might include spectators and the participants. Safety protocols, we will not see any sort of impact from these events. And the 4th of July weekend is coming soon this weekend, and we do have guidelines that we issued around the safety guidelines for the fireworks too. So just look for that on social media, especially with the fire restrictions. There's some safety measures that we're going to go over, of course, and also the gathering limits that are allowed and how to safely celebrate 4th of July. Of course, we want the safest options that you can do is celebrating with your own family. Your own relatives that come, make sure they come to your house, make sure they wear their mask. Although other options that we still recommend, of course, is the virtual options. If your family is far away, using some sort of virtual gathering can still be recommended. So. And just remember that we also have a mask mandate, and to wear that either indoors and outdoors as well. So among other people that are not typically from your household. Although because there are still people with COVID, getting COVID out there. Make sure you stay home, don't go to work. If you're asymptomatic, make sure you're aware of making sure people are vaccinated. I know people are doing that. Some organizations are saying you can participate in this event if you're vaccinated. And I've also heard that some family members that are gathering are also saying that if you're welcome, if you're vaccinated, you can come to our family event. So there are ways that people are ensuring that we are all following the CDC guidelines and recommendations as well. So those are the major public health emergency order limits, expanded gathering limits, and then we also still have a curfew between 11 p.m. and 5 a.m. every morning. So meaning making sure you try to travel within that time frame and do all you can. I know that people will be celebrating this weekend, and if your family wants to celebrate safely, the guidelines will be issued out on our public health page, Navajo Department of Health Facebook page, and there's no harm in trying to do drive-through, curbside to-go plates or things like that. That people might still enjoy that option. It's just giving food to family members and friends to celebrate 4th of July. So. And then just as a quick reminder that vaccine is important. If we want the nation to reopen fully one of these days, we need to get our vaccinations up for everyone that are eligible to get vaccinated. And these are among individuals that are young adults to 40-year-olds that are on the Navajo Nation to get vaccinated. So don city Keston hik AC bon city Keston hit the nation with our petty the costin saginas yaga de Nielsen also. Thank you very much for joining. Now I'm going to introduce Captain Brian Johnson. He's with the Navajo Area Office and a team member of our Health Command Operations Center. So take it away, Captain Johnson.
Okay, thank you, Dr. Jim. Thank you for your report, as well as President Mez's report and Vice President Lizer. It's nice to be here again this morning. And again, this is Captain Brian Johnson, serve as the acting Deputy Area Director for the Navajo Area Indian Health Service, and continue to not only do our normal duties that we do on a daily basis within the Indian Health Service with all of the federal health facilities and working with our tribal partners, but also continuing to work diligently on the COVID-19. And we just can continue to do what we can to support the local population and making sure that we continue the trend and the trajectory of low cases here on the Navajo Nation. Again, we do continue to work looking and monitoring on case numbers throughout the Navajo Nation. Again, working with the Health Command Operations Center, with Dr. Jill Jim leading that effort, and working with the tribal health organizations as well, sharing information, sharing experiences, case management information for any cases that we do have, and making sure that we're responding in a very appropriate way. We also continue to monitor the testing positivity rates around the Navajo Nation, the hospital capacity. We always look at the inpatient beds, whether we're talking about ICU or just the inpatient wards, to make sure that we understand what capacity we have locally, as we've seen during the pandemic earlier when some of our areas, some of our facilities were filling up with patients. But more recently, with the lower number of cases, we're doing, of course, much better in that way. And then also our contact tracing capacity continues to be put in place and responding as well. Again, we continue to be in the yellow phase, as was mentioned earlier here. So that's 10 weeks in a row that we've been in the yellow phase, trying to continue improving our gating measures so that we can get to that green phase. And we are certainly very, very close to that. And as Dr. Jim had mentioned earlier on this session, on June 18th, the Navajo Department of Health issued Public Health Emergency Order number 12, which lifted the stay-at-home order, but replaced it with a safer-at-home order, just recognizing that though our case numbers are certainly fewer across the Navajo Nation, we do still know that there are exposures that can and do happen. And so we continue to recommend and just suggest to folks that certainly safer at home is a key message to the population. So as President Nez had mentioned also during this session, we continue to watch those states in the surrounding areas, and some of the states that are certainly feeling the impacts of COVID-19 and having a higher number of cases include our neighboring states of Utah and Colorado and Arizona. And thankfully, New Mexico is certainly going on a downward trend, which is great. And then Navajo Nation is doing much better when we look across the spectrum of how the states and the tribes are comparing. And so we continue to offer COVID-19 testing throughout the Navajo area. And again, looking at things as a healthcare system on the Navajo Nation, we do know that whether we're talking about the federal sites or the tribal sites, COVID-19 testing continues to happen, continues to be offered. And we do recommend, if you feel for any reason that you have symptoms that are consistent with COVID-19, or if you just have a concern, certainly contact your local facility and you can still be tested. Again, the major message in this session, as well as previous sessions, is just how important the COVID vaccinations or the COVID vaccines are in terms of continuing to fight this pandemic. We are looking to continue increasing those vaccination rates and the numbers of folks getting either the 2 doses or the 1 dose of Johnson & Johnson. But we just continue to support and highly recommend the folks getting their vaccinations and making sure that they complete whichever regimen that they choose, whether it be Moderna, Pfizer, or Johnson & Johnson. We continue with the Indian Health Service, and again, working with our tribal health organization, our partners. We continue to have an ample supply of vaccine and continue to make sure that those are distributed appropriately around the Navajo Nation, making sure that those supplies are available should we have an increase in folks interested in continuing to get their vaccination. And as was mentioned earlier, the age groups of 12 all the way up are eligible for vaccinations in terms of the emergency use authorization. And so, if you have children between the ages of 12 and 15 years old, or if you have family members beyond that age, those ages, those are all eligible for these vaccines. And one of the things, again, we continue to advocate and encourage is that members among a household, if one is vaccinated, all should be vaccinated in those households. Just looking at the statistics and the numbers of infections, it's really critical that those among households do have the full vaccinations for each individual in that home. Again, and that's the only way we're going to reach community immunity is by making sure that we increase those vaccination rates to the highest possible number that we can. And so I just want to make sure that folks understand that we continue to monitor and we continue to look and work with the Navajo Nation and tribal health organizations in terms of monitoring the various variants of the disease. Again, we've talked about this before on this series or in this session concerning what is a variant and what is a mutation of the COVID-19 virus. And it's just the different, if you will, it's the different strains of the virus that are circulating in our environment. They are referred to as variants. And we do know that there are multiple variants that are out and about, and some of those are here on the Navajo Nation, while there are others, other locations in the United States. And there are very specific detailed studies going on with various organizations looking at the variants to try to understand how effective the vaccines are, the available vaccines. And so those types of studies and those types of assessments are underway. And certainly scientists are learning more and more about these variants and how they react. So I think the important takeaway for today is, our numbers on the Navajo Nation continue to stay low, but again, we need to remain vigilant. We know that the Navajo Nation is choosing to keep the mask mandate in place, and it does continue to be an effective way to help control this disease and help keep our numbers down. So we certainly do continue to recommend everyone wear the mask. Also, again, monitoring the variant forms. So the various forms of the variant we continue to monitor, and those are being tracked with the Navajo Nation Department of Health and all of the health facilities on the Navajo Nation to understand where the variants are located that we've experienced thus far in recent weeks. And we also want to be able to just recommend folks, I know this goes back to basic hygiene, but we continue to highly recommend washing hands. I know that folks did a very good job during the major part of the pandemic, but we can't let up now with our hand washing, whether we're using regular old-fashioned soap and water or using our hand sanitizers. Very, very important process and method of preventing this disease. And then also, again, I mentioned testing and how we're doing across the Navajo Nation. Be sure to take advantage of that testing if you have any questions of whether you're having symptoms or possibly been exposed. That testing is available to you and your family. And again, just making sure that you get your vaccinations as soon as possible. And by doing these things, we can definitely continue to get closer to community immunity, which will protect not only yourself, but your family and your elders. So I'm going to stop there, and I think I'll turn it over to our colleague, Dr. Burrage, from the Tuba City Regional Healthcare Corporation. So take it away, Dr. Burrage.
Morning. Thank you, Dr. Johnson, Dr. Jim, and Mr. President and Vice President. My name is Amanda Burrage. I am a pediatrician and leading the FDA response team here in Tuba City. I really just want to reiterate what everyone else has said so far this morning, but really emphasizing a few key points. So as mentioned, our cases this week across Navajo Nation, or I guess representing last week, are the lowest they've been since this pandemic started, which is fantastic news. We've had 20 cases, and our percent positivity was 2.5%, which again is great, and part of everyone's work in wearing masks and getting vaccinated and distancing. However, I do want to reiterate the concerns about the Delta variant that has been recognized across the United States and increasing quite rapidly in the Four Corner region. We are seeing more and more cases of Delta variant in the Four Corner region, and certainly want to keep up our levels of protection and really encourage vaccination, because we do know that vaccination against the Delta variant works very well. So it appears that 2 doses of the vaccines are 90% effective against Delta variant, but only 1 dose is about 30%. And so if you've only received 1 dose so far, I strongly encourage you to come in for your 2nd dose. If you haven't been vaccinated at all, I very strongly encourage you to come get vaccinated, because while we have made incredible progress and our cases are the lowest they've been, we know that the COVID and the Delta variant are around, and we need to continue to protect ourselves and our communities. I also want to emphasize testing. As Dr. Johnson mentioned, testing still continues to be critically important. Anyone who has any symptoms that could be COVID, whether or not you are vaccinated. So if you are vaccinated or if you are unvaccinated, we encourage you to get tested if there's any symptoms that could be COVID, or if there's any exposure. We do still know it's circulating, and we want to identify cases as quickly as possible so we can do contact tracing and contain from any super spreader events or big spread like we saw earlier in the pandemic. I also want to celebrate the likely reopening of schools with the legislation that was mentioned before. And schools opening for in-person learning is great news for our children and for our communities. With the mitigation efforts that schools have been planning for the past year, they are safe. And just a reminder that in-person learning is really critically important for our children in terms of their social support, their mental health, and learning. And so I encourage everyone to strongly consider sending their children back for in-person learning. I think this is a great step at this point in the pandemic, and we're excited to be supporting schools in their reopening measures and how to keep children and teachers safe. Also, just an extra plug for teachers and for kids that are 12 and older to get vaccinated. That is a really important piece to keep the schools as safe as possible. So also just want to, I saw a question in the chat about home visits and sort of how to keep staff safe who are going into patients' homes. I think certainly vaccination and full vaccination for individuals doing that, masking really is all that needs to be done to keep people safe in terms of those home visits outside if possible. But, as with the Navajo Nation reopening, as mentioned, there will be a lot more interactions, but the measures that we've had in place, vaccination and masking, continue to be strongly encouraged to help keep everyone safe. So again, I want to pause and congratulate and celebrate the low cases in the past week, but again, encourage everyone to keep up what you're doing in terms of efforts to get vaccinated, to keep masking, and to keep everyone safe. So I will pause there and pass to Dr. Fowler. Thank you.
Thank you, Dr. Burrage and Mr. Captain Johnson. Thank you for the services you provide to our people and our communities. Most importantly, we thank you for the updates that you provide to us. Ya te shikedoshne kodoshe ya otadas anodinihe is the enen lini e ya ani edi nalnihi betatel naigi yego ya hotzado ati yago nal kejo kodo ba he nitzen ado ni hito sato ot edo kodo behes anin lini hichiton hize abatata des balanda kai kodo ihe an hilne eze il ene ado di da al kahido ati besnaho a konde alalanje yadi eze al enigi ati ben khahot ito aje bekachana nitzen di khachinen tilkeji kain lini na kits at dato ta kapeta khayki eze bahalong ado ba ultra atana lini ultra benaz aje nashnishi ni hito na kha at tsikhala ya khoshite na hol jesti benit at osabi itrahna da ilte jo kodoshi basht anadi ne na khachinen lini Johat a kodo da o kan hinat ani lini do a hot kodo ya she se be hasht di hashino sa di na hona khado a ndal yai ban hilta hojja jo konda an hinit ad be eta ahuiliado be eta ha ilzi jot ya na honeta Oko o no yun leikin trahon da doch kato de kat dahon no slan do dash ni hit ni jo ai da bi ne da do kat na khidoi wach bi khadita oko ajeti de tradahan hi chinton hi ze betata is balong na khai ba a he ni zen oko o yun hit ne endlini den da khai ati bichinto bezeta da des balon da khe ko ba he nitzen he sato be eta akhliya don hinna godo ho wadna has ani ba akhliani binnache shin sa khodo ba he de nesi dik ad chido chido ze betata des balon yash benna asa honna asata ako ado dinan nishte ya ati ben de khilto ano national ito hajobe na kha ashi inni la atate tlante yajilti hajet taso to ya at da ado hanao but dajil mushi jo ba nitzen. I'd like to acknowledge all our Navajo people, our leaders, our Diné people that are out there that are starting to travel, going back to the reopening areas. We want to thank you and acknowledge and appreciate you for continuing to wear your mask in the cities while you're going shopping, while you're fueling, going into restaurants and taking off your mask until you're going to eat. We really appreciate you. We have been observed and seen a lot of our Navajo people wearing their mask. We want you to continue wearing your mask because we are, as a Navajo Nation, we are still mandating that you wear your mask. A quick update on the virus and the variant update. We have our healthcare professions. Yes, we did go low on our numbers. On near yon desk the variant nini jo the nick be'elile ati ni. Akwa ben na be'eta ahosia di ini yahanana ni iti delta variant isne yego atahoni gahi it akonde ha o siko sato betetos ni to yego hatahoteno kata jashi zel ilne yahaji yan de jo kodobe nan hit him. Dik ad nes na tamo as li kune la iti litsogi bi ikha akwalta ko naka ata asiko dito eji bi iti ka ne koji ya ani linde chik edo shidne nakapa ahonos di is ich inido is ne kahatan linido ajin da kahi yego satopik ahani ido aj it's easier and nito din not ni and ni hijo aja sato banache din not liniki aja is ich in a day aja days and it's a kodona hapa akonasin to aja yego ye and ni we like to continue to encourage you to get your vaccination. We understand it's voluntary, but we continue to encourage for you to get vaccinated. We know that we do have some individuals that do not want the vaccine, but within our workplace, within all these other areas we go to, we now have some businesses that require that you show proof of vaccination. A lot of this falls on our own responsibility. It's important that we practice and preach our self-responsibility. There's a lot of lessons that we've learned from COVID-19. And in order for us to move forward, we got to be resilient. We had to have the understanding of our common ground and practice our common sense. Nasko net hin schnada ha ela bits ada bohor anti nas nehi ha le ha ela yegu ye nationalist ha ako o yudi na handal nishido nas national sinigi yego basic ado benache chete ha shine la sado ya la cheta ha nelde jobich in hits kedovich in hits zidovich ha ini no Nastot hashino na kodot so bizin a quijaben so zido bayatki jashin here or in and jo ada ada o kodo behiti soda. A ko is a kodonat linido is in a day nishija aja dan hitne ashwandin hitchidon his abadat the days balon dake. Nihilla that tos zilebe do talawashbet a hantan dakis. Dit verstoot ini benat sedi tlahulieni senhen senator edo hajochedo adon hitana hajego sta des is da keko jo edo kododien hite yoke adana e kodobesh bahanedo sahatasi zi aje yadi in-person meeting dehnini di nahnishin nahtini aje do naha analia. So the general requirement in the reopening guidelines, which is available on Department of Health website for in-person training and meetings. The general requirements, only hybrid meetings are allowed. The nais tan asa alehiki jo ebe hot e akondet ada kwihiko ebe has do di how na ashi asa alehiki jo edo asa alehyan e eji. Heidosse, qua ehonel taohas ala, do anar chigodadel kata adat, edo di tasonda, alt son adat, alja enash chi ibn dan hitne, ako aja behes ani hatadel net, do hatel ya, edo big ahonas. In-person meeting time frame is limited to 6 hours or less. Ahas tan ehel kito ya, but lehi, band or Dr. Hashini Eddie the Neni Lini Nzago Hata the Nitsi a condajo ACA on here be hidden zendo be chahanat or she qua yat el Islahalehin da of Setole Adoti Hashino na 80 besh bahane be hidden the Hashne a be hot it dodin up in Sekesi dot out as a meeting Kodon Hilhashne Johot ado be hot it. Ado di aje zait in the do Kodobes ani hatadilian nini, etla alego haishin yoswali, edo sahot abin sekes ein hahan zinishi na kwa naha or segot hato hasnini, jo edo hot abe ba hot it. The host will be following basic COVID-19 safety practices. Jo hachido hazet betata espala ehon jagado hasne ado di chiyan da chon on di toyit lanido betandit aholoni aj yape hoti ado chiyan ahon ne etato dili sahodo yanahas anda oja el idot o de jiyito to go de nabelagana kejo ot yisne ado di ad eslahalle yahajagado ado hayel ende yahajja to yahajjita jo ad ati feshi eslahalle yinaha ani eshi ket na khani donne. Screening prior to start of training or work session. All person attending must be self-screened. So this guideline is available on our DOH website. And if you're the host of any meetings, please make sure that you follow proper hygiene safety protocols and encourage your 6 feet distance. And then if you're meeting outside, you're allowing people to bring their own chairs. Please let them know in advance. Kodo yo in hini nini ben na chotan hichahaneze. Asa the mo na itleche na the mo do tra yo kashon ado the mo bis kana aho do saho ha ishi le kinahal ke ha ishi es le peso kode kinahal ke de be landa ilehi kode be enahot iki be inido ben on shi edo ben hislahanne. Diltsena kwaekeya na rajdo na tloshida. Aro di it's is na ho putal na ibe ka yedi eda. Aro di ho wana has ango rental assistant that they na ajita banda huilne. Ako diltsena to sa banata huilne. De edi beshe chi das ido sa as yugo be yatatni onigo jo edo bahon na hita ebe o watina ka actionen lini o yu da otka akodin hi besh bahan na eta ondan sis ado hat ashon the login it is in da ondan sis which da hoina jo aja peso be na wo edo ashine la ba na huilne aja khan la ba na hanen hit that don't know could your website be onata nadol kito should now on the jinzo agent kit. We have been providing town halls. We appreciate all the listeners that have been tuning in. On Wednesdays, we also provide some town hall information on Monday evenings. So that talks about various assistance. We did cover a lot of USDA information regarding livestock farming. We also covered some burial assistance information, rental assistance information for our communities. And then also recently, the broadband assistance from from the FEMA, the emergency management. So those are a lot of information that we share. We appreciate all of you that are tuning in. And then we want to say thank you. This will end our town hall for today. Thank you to all the listeners. We want you to continue to be safe, continue wearing your mask, wash your hands, and keeping the physical distance. Kodo yadi at the more yajit the more gonna July 4th ne Eshin Hashino Nashi Pita Sato Hita Sande Abe eta Hoslian Shikedo Shitne Atina Don Hit at Nido Dots eat ehi et a conde be eta Hosliano Jobe Chiat Adon Hizan Linido Bahoslian